Hi, Dr. Michael Corey here with Beat Hashimoto's Naturally, and today I want to talk to you just briefly about Hashimoto's and autoimmunity, because people don't realize that as the number one cause of thyroid or hypothyroid conditions in the United States is something called Hashimoto's thyroiditis or autoimmune thyroid. When people hear this, what? Well, it's Hashimoto's thyroiditis, and it's an autoimmune condition. An autoimmune condition means that it's actually your immune system that's attacking the thyroid. So your body's attacking itself. And when we look at that, the autoimmune condition is where your immune system is attacking parts of your body. And in this case, it's most likely your thyroid. Now, you might not have positive antibodies at this time. Maybe you've got just a few and you're not outside of the normal range for your doctor. But if you have any of those thyroid peroxidase markers coming up or thyroid autoantibodies coming up, in time you are going to become autoimmune and you will get the lab test to prove it. But remember that your thyroid controls your body's metabolism. Every muscle, every cell, every tissue of your body has to be regulated through the thyroid. It's a master gland, and it's super, super important that you don't just have a thyroid problem, and you have to understand that you have an immune-based problem. Immunity. That's like when you cut yourself and your body says, okay, well, we need to heal that cut. And it knows exactly what to do first, what the first step is, what the last step is, and how that healing process takes place. Well, your thyroid's doing the same thing. It's regulating. It has that crosstalk with every muscle, cell, and tissue of your entire body. Every tissue of your body has to be regulated. But unfortunately, thyroid hormones don't do anything for the autoimmune attack. 90% of people are estimated that are diagnosed with hypothyroidism actually have Hashimoto's, an autoimmune condition. All those people, if they were actually properly tested, could actually start treating the underlying condition, which is the autoimmunity. So you will continue to lose more and more of your body's ability to make its own thyroid using the medications, because you're supplementing that TSH, you're just bouncing that up and down. But what's attacking your immune system, and your immune system going back to the tissues and organs, that's specific to the immune system. And likewise, we have to make sure that we do steps and we take care of ourselves in such a way that we can take care of the immune system, bring our immunity up, make sure that we get rid of inflammation, which is a center point for all chronic conditions. But if you only depend on the medications, you are going to look at a slow and progressive downward slide as far as your symptoms. And that's the reason why so many of you out there are taking your levothyroxine, your Synthroids, and you're going through it and you're looking at Armour and all these other medications, and you're hoping that that will solve the problem. We have to get down to the nitty-gritty. We've got to take responsibility, pull on the britches, and make sure that we take the steps and we correct the problems that have created societal problems and is damaging families and destructing families. You know, I found out about my Hashimoto's, and now I know as a fact that my father has Hashimoto's, my mother has Hashimoto's. It's not something that just started with me. I highly encourage you to make sure you follow up with your family members as well, because autoimmunity is not anything to mess with. So the problem isn't just your thyroid, it is your immune system. You have an immune system problem and you need to heal the immune system. We do that through decreased inflammation. We do that through dietary changes. We do that through proper supplementation, following proper testing. Now, the problem with the autoimmune condition is that it doesn't just attack one area of your body. It can attack multiple areas of your body. In fact, I have many, many patients that have multiple autoimmune conditions. Why was that? Because the underlying causes of the problem were never corrected in the first place. We let our health slip away. It goes down and we accept it. It comes down again, we accept it. It comes down again, we accept it. And then we have a catastrophe. The fire's burning, the house is burning from the outside in, from the inside out. You can't stop it unless you go back and you correct the problems. Now, it can attack other areas of your body, as I mentioned. It can attack your pancreas, causing diabetes, your gut and your stomach lining, causing IBS. It can cause problems with your joints, leading to rheumatoid arthritis. It can attack your entire body. Muscle cells, nerves, tissues, everything that thyroid is regulated. Your immune system controls all tissues. So we have to look at what are we going to do about it. Well, we want to make sure that we correct it by starting with proper testing. We need to confirm autoimmunity. We need to have your thyroid autoantibodies checked. Now, I also do a comprehensive panel. We do the C-reactive protein. We want to look at the liver enzymes. We want to look at your histamine levels. We want to look at homocysteine. We want to look at all of those inflammatory markers, anything that's throwing off your adrenals, your blood sugar levels, and that's when we can go through and we can find out what the roadmap is and what's right for each individual patient. So if we want to learn more about anything that we're talking about, by all means, I'd like you to make some comments down below. What we'll do is we'll go through, I'll look at those, and we'll take it into consideration for future videos. I'm going to do some lengthy videos for you regarding glyphosate, about wheat and gluten, and we're going to make sure that we get you the information that you need. So if you have any comments, by all means, put it underneath this video. I look forward to seeing you on the next video, and thanks again for being a member here at Beat Hashimoto's Naturally. Thanks. Have a great day.